thank you everyone for joining us again for our Kentucky EVV Town Hall this afternoon, October the 25th, 2023. We appreciate you guys joining us as part of our ongoing series to get you the information that you need in preparation for our ongoing onboarding processes and training and going live with electronic visit verification through the Therapy Services platform in the state of Kentucky. So again, we do appreciate you guys giving us some of your time this afternoon. Just a little bit of quick housekeeping before we get things going. A couple of quick webinar tips and tricks through Zoom. I'm assuming most everybody's, this is pretty old hat by now, but obviously if you got in here and you're hearing my voice, then you know how to get into Zoom. But should you get kicked off for your internet or need to dial in or anything of that nature, did want to make sure that folks were aware we do have a dial in option for those that need to take advantage of it. We also have a chat icon as part of the Zoom platform. If you're having any trouble hearing or anything like that, and you want to drop something in the chat, we've got a lot of folks keeping an eye on it. So we'll see if we can help troubleshoot some things for you. So please do so. Another big part of the intent of these town halls is for you to get the information that you need and for you to get your questions answered. So we also want to encourage everybody to utilize the Q&A option within your Zoom panel. Hopefully you guys can see that. I've got a little picture of what it looks like right here on the screen. But essentially, as we continue to go through these, I know many of you have been submitting questions that we greatly appreciate that over the course of the last few town halls, and we're going to continue to do so. As I said, we've got a lot of folks on our side kind of keeping an eye on that, and we'll try to get in there and answer as many of the questions as we can going through. I know a lot of our Kentucky staff are doing that, but for those that we're not able to answer, we're also gathering that information at the conclusion of all of these town halls and compiling it and getting the answers done and posting it in a public forum for you guys to go back and see in case you forget the answers to some of them. We've got that there. I'm going to make sure you all have the URL to get to that site as we go through the presentation. But we really, really encourage you to get in there and ask those questions, because I guarantee if you've got a question, then somebody else on the call has the same one. And so it's beneficial for all involved if folks stay engaged and ask questions about the material that's getting covered. So with that, let me formally introduce myself. Hopefully by now you guys know who I am. I am Jason Laws from Therapy Services. I'm one of our leads on the implementation team for the EVV project here in Kentucky. Great, again, to be with you all. But today I did not come alone. I brought a couple of friends of mine from Therapy, Mr. Nick Anderson and Ms. Shawnette Lancaster. These are two of our senior support specialists on the Therapy State team, and in particular, specialists with electronic visit verification. And what we're going to do, we're going to start off with some introductory information, some review of things that hopefully you guys probably already know, but want to make sure to get you up to speed. But then the bulk of our time is going to be spent with Nick and Shawnette getting into the actual system itself and really demonstrating some of that onboarding process. I know some of you guys have already gotten started with this. Others of you have submitted your information. You're getting ready to get started, that sort of thing. But we want to give you a firsthand look at some of the things that you're going to be doing on the calls. So that's going to be a lot of the content that we cover today. So our formal agenda, as I said, I want to reintroduce the project and the associated timelines. Again, this is all information that hopefully everyone out there is familiar with, but we want to keep repeating it so that we've got those dates and things right in front of us consistently so that we can remember the timelines that we're working on and everything that we've got to get done. I want to also do a quick review of some preparation that you all can do ahead of your onboarding calls with the therapy specialists. That can really make the process move that much more smoothly, having the proper data available, having the right team members involved, all of that sort of stuff. We spent a good deal of time on that last week, but I do want to review it quickly today because I think it's helpful information to reference. And then we'll hand it over to the stars of the show, and Nick and Shawnette, to go over some of the live demonstration. And once we've done that, we'll review some of the questions that have been asked over the course of the last couple of town halls and kind of lay out the timeline and expectations for town halls going forward. So that's our plan for today. So with that in mind, let's go ahead and get started here with just the general project overview and description. Again, recognizing this is review for many of you, but still good information to consistently see. Therapy Services is the contracted vendor for electronic visit verification for home health and soon to be personal care services in the state of Kentucky. Well, what does that mean? Essentially, what that means is that the state has gone under contract with us to provide to you a comprehensive and mature electronic visit verification platform, easy for me to say, that you guys can use at no charge whatsoever to collect your EVV data and then send that data over to a secondary therapy application, which we refer to as our aggregator. That's how you're able to meet the requirements for EVV in the state of Kentucky. So there's kind of two pieces of it. You can collect data through the therapy application and send it over to the aggregator, where all of that data gets compiled and gets used to validate claims for services being provided under EVV. So that's option number one. Option number two is that you also have the choice, should you choose to use it, to utilize what we refer to as a third-party vendor EVV platform. And we've had a lot of questions come in and regarding what exactly does that mean? What exactly is a third-party vendor? And we're going to talk about that a little bit more towards the end of the call today. It's one of the FAQs we're going to review. But again, just a reminder to anybody out there wondering exactly what we mean by third-party vendor. Essentially what that is that should you, rather than utilize the state-provided EVV platform, which is Therap, you have the option of utilizing your own EVV platform, either through an existing contract you may have with your own EHR or your own EVV provider that you would like to continue to use, which you are certainly welcome to do so. You can collect that data. Now, the caveat being your chosen EVV system does still have to be able to send data to the Therap aggregator so that that data can then get combined with all of the data coming in from the Therap EVV platform so that the state can get the necessary information they need, that we can validate all the claims and all of that sort of stuff. But again, you do have the choice of utilizing your own third-party vendor. And if you choose to do it, you need to let us know. I'm going to remind everybody in just a minute how you can let us know. But once you tell us that, we're going to get you the necessary information for us to go through the testing and certification of your EVV vendor to make sure that it meets the requirements to be able to share data with our aggregator. So that's kind of the short version. But again, we'll talk more about this as we continue to go through the presentation today. Again, for home health, the expectation for everyone is that we are going to be going live with this on December the 28th, 2023. Now, again, some of you who may not have been on last week's call, you may be thinking, well, I thought it was January 1st. What happened to those 3 days? January 1st is the official required day that everyone has to be using EVV in home health in the state of Kentucky. We're providing this 12/28 day with the expectation and understanding that on that date, the EVV platform will be ready and available for folks to start using. So that's why we're using this date here. So in the event that anyone has any questions about that. Kind of the general timeline of which we're kind of making our way through here. Most of you guys have seen this before, but essentially what this is kind of gives you a roadmap of where we've gone or where we've come from and where we're going as part of this project. You know, over the last several months, we were in preparations with CHFS and getting everything prepared. We kicked off our town halls a few weeks back with the initial one on September 29th. And since that time, we've been engaged in the provider onboarding process, engaging you guys to let us know if you're going to use Therap's EVV or a third-party system, getting you onto your initial onboarding calls with our specialists. And that continues to happen and will continue to happen over the course of the next few weeks. We're also, as we're onboarding folks into the Therap platform, going to be transitioning into more formal training, which you see here, which will be in the months of October, towards the end of the month here in October and into November, where we're providing specific training on using the system. And to distinguish between kind of that onboarding and the onboarding is getting you set up and running. The training is, okay, how do we use it? How does our staff create schedules in the system, check in and out, that sort of stuff. And so we're going to be doing all of that. We'll then have all of the final testing and training and everything that's going to be occurring in November and December with that go live date of 12/28. So what does that onboarding process looks like? Well, the good news is, I know several of you have gotten started with this, but for those of you that have not, again, just a reminder, and I know we repeat this many, many times, but it's so important for folks to understand the options that you have. You do have two options available to you in terms of how you meet this EVV requirement for home health in the state of Kentucky. The first option is utilizing the state system, which is Therap's electronic visit verification platform. As we've said, this is provided to you at no cost through the state contract. You're able to go in, set up the Therap account for your staff to be able to collect EVV data, send that over to the aggregator, and go from there. It's probably the most straightforward process, and certainly the one that we expect most folks to take advantage of. Having said that, as I mentioned before, you do have the option of utilizing the third-party system, meaning you have the option of using your own chosen EVV platform. Now, obviously, in that case, it would be at your organization's expense because it's managed by you through your direct relationship with that particular vendor. But you can collect your EVV data there and then send that data over to the aggregator. Again, assuming that's the path that some of you want to go on, we will be working with your chosen vendor to make that connection to the aggregator and do the testing and the certification and all of those things. And we'll talk a little bit more about exactly what that process looks like. And just as a quick heads up, we're going to be talking about that in a lot more detail in our town hall next week. I know we've got some requests from the state of Kentucky that we want to really cover that in detail in one of our town halls. So we plan to do that next week as well. Now, once you've started this process, again, there's kind of three buckets of activities that you're going to be participating in. The first one, as you see there on the left, is what you're doing right now, and that's the ongoing town halls that we do every week. Hopefully, you guys have been able to join a few of these. If I'm not mistaken, I believe this is the fourth one that we've done really since the end of September through now. If you're just kind of, for whatever reason, just now kind of getting engaged and kind of wondering what you missed, the good news is we are posting these in a public forum. I'm going to show you where that's at in a little bit so you can go back and review the past town halls. We've got those set up so that you can easily get them and see what's covered. But again, this is really designed to be a touch point with the user base out there in Kentucky, letting you know where we are in the process, letting you guys know what to expect, covering materials and resources that we know that you need, and providing some necessary information and some trainings and demonstration, which is exactly what we're going to be doing today. The second piece of this is the onboarding. This is kind of the personal touch, for lack of a better word. This is where once you have indicated your intent to utilize either Therap's EVV platform or your third-party vendor, this is where you get set up directly with Therap. And in the instance where you're going to be using our EVV platform, this is where you're going to have an onboarding session with, or multiple sessions with our specialists live via webinar, I should say, in a virtual environment where they're walking you through the step-by-step process of creating your account. Now, today, part of what a big chunk of what Nick and Shawnette are going to be covering with you is exactly what kinds of things are going to be covered in those onboarding sessions. So you can kind of visualize what that process is going to look like and be that much more prepared when you get on the line with our folks. Now, beyond that, once you've gone through that onboarding and had your account set up and all of that, then we move on to the more formal training piece. This is, as I said before, where we move beyond just the setup of the account to the actual utilization of the account to be able to collect EVV data. So how do we create schedules? How does our staff check in and check out? Beyond that, how do we check our data within the aggregator to make sure that the data flow is working properly? All of that stuff is the kind of stuff we're going to be providing training on, and that's going to be done in a variety of ways. We're going to be covering some training right here through our town halls. We're going to be providing a lot of asynchronous training materials that you can access at any time through our site. I'm going to show you in a bit kind of a resource site we've set up for the state of Kentucky where you can get to all of that information, but there's a great deal of stuff there. And so these are kind of the things that we're going to be doing, the activities we're going to be participating in over the course of the next couple of months. Now, the provider onboarding process, you guys have heard me review this in each of our town halls, and I'll probably continue to do it at least for the next couple. The hope here being that the overwhelming majority of you guys have initiated this process by now. But with the recognition that for whatever reason, a couple of you out there may not have yet done it, I do want to at least let you know kind of how this process works. And the first thing is we have communicated out to the entire home health provider network in the state of Kentucky a link to this particular job form. And I'm going to open this up so that you guys can see it. Everyone here should have, or at least someone within your organization should have received this form via email, where you can go in and identify what type of user you are, At that point, you're going to get a series of questions that you can answer and submit to us, at which point you'll then be prompted to set up a one-on-one appointment where you can select your own date and time through a calendar app to meet with our specialist to go through that onboarding process. So I think for everyone here, you'll either be selecting whether you want to use the Therap EVV solution or whether you intend to utilize a third-party EVV vendor. If you choose to use the third-party vendor, you're still going to be submitting some information, but as you can see, the information that you submit is going to be a little bit different. We're going to ask you to identify to us who your third-party vendor is and a contact name there, so that we can help coordinate the communication between you guys as the service provider and the vendor to make sure they're getting the information they need to be able to initiate the onboarding process. So essentially, that's kind of the first step. Now, again, I absolutely hope that everybody has gotten that and has filled that out. But for any of you that has not yet, either you haven't seen that email or nobody's responded to it, you can't find it in your email, all of that sort of stuff. For any of those reasons, please reach out to us immediately at these two email addresses that you see on your screen at kysupport@therapservices.net. That's going to come directly to us, and we will follow up with you directly. You can also submit an email to the Medicaid public comment at ky.gov as well. Either of those options will let us know, and we can then follow up with you to initiate the onboarding process. Again, we do ask when you submit information to these two numbers to include some additional information that just makes it a little more helpful for us to get in touch with you and get the process rolling. Obviously, we want to know your name and contact info, but we also would like to know the name of your organization as well as your provider number. That information is going to be helpful to us to kind of identify who you are and get that process rolling. So again, anybody that's not yet heard from us, please submit your information through those things and we'll get the process up and running. Now, once that's started, as I said, it's at that point that we are going to initiate these onboarding activities. And in just a moment, I'm going to hand you guys over to Nick and Shawnette to talk through some of that and show it to you firsthand. But I do want to give a quick reminder as to some of the things that you all can do ahead of those initial calls with us that can make the process run that much more smoothly. First of all, the kinds of things that you're going to be covered on these calls, as I said before, you're going to have 2 to 3 calls, depending on a couple of variables. But the gist of all of this is that we're going to be focused on setting up your Therap account through our platform. So we're going to show you how to create administrative logins within the system, how to create your services and locations in there. We refer to those as programs and sites within our system. We're going to show you how to create the individuals for whom you provide services, how to create their information inside of the system. We're going to create what we refer to as users. But for you, that's going to be your staff, the folks that are logging in and utilizing the platform. We're going to show you how to create all of that information, how to provide the proper privileging for those users. And what I mean by that is, every staff member doesn't do the same thing, right? You have administrators, you have schedulers, you have caregivers, and they all have to have different roles when they log into Therap. So we're going to show you how to set that up and make sure folks have access to the things they need to have access for. Then we're going to transition over in the next call to talk more about EVV specific setup. How do we configure your account for electronic visit verification with the particular service authorizations and descriptions that you need and everything that you need to set up within the account to be able to collect that EVV data going forward. And again, we're going to talk about some of that. I believe Shawnette's going to be covering some of that here in just a few minutes. Then the last piece here, and this is an optional piece, but certainly one we want to make sure that you all are available or aware of, and that's utilizing Therap's billing and claiming system. On top of being an EHR with an EVV, an electronic visit verification system, we also offer the ability to do direct billing and claiming through our platform to MMIS and or the MCOs for the services that you're providing through EVV. If you want to take advantage of that, you are more than welcome to do so. It is part of the state contract. You are in no way obligated to do that. If you want to continue to bill in the way that you bill today, you're certainly welcome to do so. But if you want to use our billing platform, we do have a training set up specifically for you guys in terms of how to help set up your account in preparation for billing. And so we'll go over some things around setting up service codes and payers or in information around claims and reconciliation, that sort of stuff. One of our billing specialists, Kelly Galloway, will be the one leading you through that. We're also going to dedicate some time on one of our town halls to talking about that as well for those of you that may be interested. For the third-party vendors, when you guys submit your information, the first piece for you all is really a focus on getting business agreements in place and EULAs. And what we mean by that is end user legal agreements that have to be in place for us to work with you and with your vendor. So we're going to get you that paperwork. Once all that's completed, we'll also provide the specifications for your chosen vendor to be able to link up with our aggregator. And we're going to have our tech folks walking you through that whole process. Again, we talked about this last week, but just as a reminder, we've had some questions from some of you with concerns about, we're trying to get these agreements done with our legal folks, but we're a big company, nothing happens fast. Can we get those specs beforehand? If you would like to get the specs for the aggregator to give to your vendor before you get your agreements completed and signed, we are happy to do that. We just ask that you request us directly for that. Do not ask your vendor to ask us. We are not communicating directly with vendors. We are always working through the providers. That's our way of verifying that, yes, in fact, this vendor is working with a provider. We want to make sure that we're working in your interest to get that information over to the vendors. So we request that any request for that information come directly from you guys rather than directly from the vendors. Couple of other quick things before I hand you over to Nick here in just a moment is a few things that you can do to help be more prepared for your initial onboarding calls with us, and specifically what's the kind of data I'm going to need. A big part of setup is getting data into the system, getting my staff in there, my individuals in there, and all of that stuff. So what kind of stuff do I want to bring to the table so that I'm not ruffling through files and all of that sort of stuff when I get on the phone, that I have it available. A big thing is obviously making sure you know which services that you provide that require EVV. And we've given you this handy dandy little reference point right here on our EVV site. If you scroll down, all of the service codes for home health that require EVV are available right here on our EVV support site. So if you have any questions, you'll be able to go in and see that information. So that's kind of a starting point to know what you want to look for. In addition to that, we also want to make sure the service locations that you have that are associated with EVV, and specifically with the service authorizations for EVV. I think everyone probably knows that service auths are what drive kind of the EVV process in terms of identifying the service that an individual receives, how many units of service, all that kind of billing related information. And that's going to be tied to a particular administrative home. And so for all of you guys, all of your service auths should be tied to a particular location. That's part of the information we're going to need to do the appropriate setup. So we'll make sure you have that available as well. Obviously, we want to make sure you have information about the individuals that you provide service for, including name, gender, date of birth, Medicaid number, phone number, and residential address. And then we can, in our system, show you how to create the geolocation for those addresses so that it can be used for EVV tracking and distance variance, that sort of stuff. Now, within our platform, we do have fields for much more information than this, but this is the core data that we need to get things started. So if you can have that available on your initial calls, that will be greatly beneficial to the process. Similarly, we want to make sure that you have data for your staff members, because those are going to be the users in the system, the folks logging in and logging out, creating schedules and all that stuff. And we've got to create a profile in there for them. We ask, obviously, that you have the name of the staff and their titles. We also want to make sure that you have their Social Security number. And I want to explain that. I know a lot of folks have understandably questioned that expectation. Each staff member in the state of Kentucky who is providing service, logging in, all that sort of stuff is going to be tracked through they're going to have a unique identifier, I should say, within the therapy aggregator so that we know who's providing the service, right? And that Social Security number is foundational to being able to create that unique identifier. So that's why we're asking that you have that information in the system. Again, our staff will remind you to do that, but just kind of a heads up that having that information available is going to be helpful. Also, you're going to be creating unique logins to the system for all of your staff. So if folks have particular desired logins, or you have a particular convention like first name dot last name that you want to use in your agency, certainly up to you, but having that information available will be helpful. And then a few other pieces of info here. Obviously, your Medicaid provider number. And if you have multiple provider numbers, having all of those available to you when you're on the calls. And then your NPI numbers as well. And this really comes into play if you are planning on doing billing and claiming through the Thera platform. We'll need that information as well. So if you can have that available on the call, that will help a great deal. And then the individual service authorizations for those folks that are receiving EVV. This is what we're going to basically, that's how we are able to build the EVV platform, the schedules and all that around the service auths that folks have. So having those available so that we can start getting them into the system is going to make the process work that much more smoothly. So again, that's a great deal of information about the kinds of things to bring to the call. You also want to make sure you're thinking about the team members that you have involved, making sure you have your internal EVV team leads, the folks that understand the workflow associated with EVV, folks that really know the high level picture of how workflow works within your EVV, from administration of services, through scheduling, through checking in and checking out, through QA, through exception reporting, all the folks that are reviewing all of this information that's coming in, really knowing who does what, and having those folks on the call is going to make it that much better. An experience, I think, in terms of going through this process. So getting the right team members involved. You also want to make sure you have folks that have an understanding of what we call in our system caseloads and super roles. And basically what that means, a caseload is which individuals do I work with? If my organization supports 300 people, but I only provide care to 4 of them on a regular basis, or perhaps only 1 of them, I should have a caseload that reflects that. I don't need to see the records for everybody. I just need to see the folks that I work with. So you're able to define that in our system. Now, understandably, you're going to have some administrators that may need a much broader caseload and see everybody. That's fine as well. We can accommodate any structure of caseloads that you need, but having an understanding of that information is going to really make it a lot better through the setup. Similarly, folks that understand the roles within the system, who needs to perform which actions, having that understanding on these calls is going to help us with the role assignment and getting everybody set up to be able to do exactly what it is that they need to do. So again, that's just a lot of stuff to be thinking about. Again, we're going to post this video. We're going to post this PowerPoint for you to refer back to. But those are some things to be thinking of in preparation for your initial calls. With that, I am going to now turn you guys over to our specialist to give you a sense of exactly what's going to be covered within the live demonstration. One thing I want to kind of set up for you here as we start this off with Nick is that he's going to start off by kind of showing you the end product. You know, sometimes the process makes more sense if you know exactly what it is that you're building towards. So Nick's going to kind of start at the end by showing you what the final product's going to be look like in terms of folks being able to check in and out of the system. And then we're going to work back in terms of how to get there. What's the information that you're going to need to do through onboarding to get us to the finish line? And so with that, I'm going to stop sharing my screen, and I am going to hand you over to Mr. Nick Anderson.
Thank you, Jason. So I'm going to go ahead and just start real briefly, like I said, or like Jason had mentioned earlier, showing kind of this end product, okay? EVV, and just to make sure everyone's kind of on that same page, electronic visit verification, right, is different. And I know there may be some overlap, especially if you're at an agency that's providing, you know, those personal care services. You may have been doing EVV for a while now, right? But there may be some home health providers that haven't been doing that. So I just want to make sure we're kind of all on the same page with that. EVV requires 6 data elements, all right? And I think the best way, actually, and the most accurate way to capture those 6 data elements is by using our mobile application. We have other methods of collecting EVV. However, like I said, I think this is going to be the easiest for you all as administrators, and I think it provides you with the most amount of flexibility. All right. So I'm going to go ahead and just get logged in here, and I'll show you our mobile app. I'm getting logged in with a biometric feature, just so you don't have to watch me type in my password. And essentially, we are going to be focusing on the scheduling EVV right here. So as I tap on the left, this is going to show me a couple of things. All right. Like the majority of vendors that are collecting EVV, it's usually done through like some form of a schedule. And that is certainly something that we offer. As you can see on my screen here, it's showing me what I have for my agenda for the day. And it looks like I was supposed to work with Stephen Wheeler at 10 a.m. And it looks like I was going to be doing private duty independent nursing with him. You can go back and your staff are able to look at previous days or what they have coming up. So if you're interested in scheduling, you have the ability to do that. Your staff then, when they go to check in and check out, they can actually just kind of swipe and do a check-in, and that's going to start gathering that information. What I am actually most excited about is not necessarily the scheduling piece with that, but I want to show you the self check-in process. All right. This is something that is not necessarily required, but again, thinking back to you all as administrators, I know you have a lot to do, and I know that there are a lot of things that need your attention. So if taking the time to create schedules and even copying them is not something that you particularly find attractive for an option, you are able to allow your staff to do the self check-in option. All right. So that's what I'm going to go ahead and do. I'm just going to hit the self check-in. And essentially what your staff are going to be doing is they're going to be creating kind of this schedule slot with the information that they should know. So for instance, the first thing I need to put in here is what individual am I working with? And like Jason had mentioned earlier, that can vary. So when I click on this individual tab or this individual right here, this is going to give me a list that you all as administrators can control. So if you have kind of like a smaller sized agency where there's maybe 10 people receiving services and everyone kind of works for every other person, maybe this user needs to see 10 or 15 people, right? Maybe it's a large agency and maybe you only have one person working with them. So you're able to control the individuals that each of your staff are going to see. And we'll talk a little bit more about that later. I'm going to go ahead and pick on Tyler Evans here. All right. So I'll select my individual. I'll need to select what program I'm working for him in. And I'm just going to do that supported living services. And now I need to select whatever service I'm going to be providing. This service or these list of services, I should say, is again something that's customizable for you as the administrator of this account. You're able to set up what services your staff should be able to check in and check out for. You can limit those to self check-in and check out if you want to. And they're only going to be able to select a service that you've approved for them, that they have an active authorization for. All right. So once your staff end up selecting these three pieces, when they hit next, it's going to pull your location. All right. So you can see that I'm here in the middle of nowhere in South Dakota. If I want to leave a comment, I can leave a comment. If not, that's fine. I'm just going to go ahead and hit this little checkbox, and it's going to actually create a brand new slot for me. You'll notice there's a couple of different color variations here. All right. There's kind of that vertical line with Steven, and that's blue. So that's just showing me it's a scheduled slot that I haven't done anything with. Right below that is the new one that I've created for Tyler, where it's that yellow orangish color, which indicates that I've checked in, but I have not checked out. And then if I actually jump to the previous day, I can see that there's that green vertical line there that's showing me that I've checked in and I've checked out for that service. Once your staff have checked in, they don't need to leave the mobile app up and running. All right. They're able to log out. They're able to provide whatever service they need to provide. So once they log out, they can go provide those services. When it's time for them to check out again, they can open up the mobile app. It may make them sign in again, depending on how long they've been out of it for. We'll tap that scheduling EVV. And then instead of doing that self check-in, they can either tap on this slot that's been created for Tyler Evans, or they can do that swipe and go to checkout. There's an attestation, so I'll agree with that. Again, it's going to pull my location, and I'm going to go ahead and hit that top little check mark to checkout. So with EVV, I mentioned earlier, there are 6 data elements, and this is how we capture all of those 6 data elements. When I click on this slot, I can see, so the 6 are the individual who's receiving the services, which is Tyler. The second is the service, which is that private duty nursing. The third is who's providing the service, which is me, and that's captured by a unique login that we have to our system. And then everything else is date, time, and location. So again, I have all that down there, and it's checking the date, the time, and it has that address that I've been checking in and out for. All right, so that's just kind of an overview on the EVV process, and hopefully we're kind of all on the same page with that. And an important thing to think about here, and like I said, kind of the reason that I wanted to show you this part initially is so that you can think about this before we start getting set up. How are you going to want your staff to be able to do this? I mean, do you want to give them the ability to do that self check-in? Are they going to be covering for multiple people? Do they have to have a larger caseload? Do you want to have it restricted to just a smaller caseload? Again, those are all sorts of things that I think is really helpful to be able to see and to kind of think about before we actually start meeting with you all for this process. All right, so that's about all I have on the mobile app right now. I'm going to hand it over to Shawnette, and she is going to show you how to enter an individual into your account. So
Thank you, Nick.
Sharing.
Perfect. Thank you, Nick, so much. That was a great demo. I really like seeing the end user process for our users. So I'm going to go ahead and share my screen now and get into TheraP. And hopefully everyone can see my dashboard. So when you guys initially get logged into the system, this is what it's going to look like. And as a reminder, today I'm logged in as a demo staff member named Mia Cole. And all information that you see, whether it's with Nick doing presenting or myself, we only share fictitious information with you guys. So no real names, no real addresses or anything of that nature. When you get logged in, some of you guys are going to be deemed as what's called a super admin in the system. And there's a couple things I just want to mention really quickly. So when you see us jumping around, you'll understand where we're kind of going in the system. Over here on the left, you're going to see these navigational tabs, meaning if I click on one of them, it's going to take me to another place in the system. You guys can see that I'm primarily on my admin tab. You'll notice it's blue, and it's divvied out in various sections. So we've got our general, we have our care, and depending on how much access in the system, you'll have various sections on your dashboard. If for some reason you need to get back to this main screen, you'll click the word dashboard or that TheraP logo. And I just like to mention that so it kind of helps as a sneak preview of your initial training with us here at TheraP. So the first things we're going to talk about is how to do that initial intake with the individuals and which you guys support. And at your agency, they might be referenced as patients or clients, and TheraP, they're referenced as individuals. So in order to do that, I'm going to jump down to the care section. You're going to see the section that is titled Individual Intake. And it's really your initial intake for the client or patient at your agency. So I'm going to start out by clicking New. And when I click New, it's going to open up a new page. And this is titled the Individual Demographic Form. Here at TheraP, we like to reference that as IDF. And you can see at the top, it's saying New. There's a lot of information regarding the basic demographics. But we're only going to focus on the EVV components that are required. So we're going to start out with those 5 data points. It might be actually a little bit more, but first name, last name, date of birth, gender, Medicaid number, those are required for EVV. So you would go ahead and type these in each one of these sections. Again, first name, last name, gender, Medicaid, and date of birth. Okay. The rest of this information, we can leave it and bypass it. The next thing you're going to notice that you're already linked to the state of Kentucky. That's already been done for you guys. You will come down to the residential address and you're going to go ahead and enter the address of that individual. Once you enter the address, you're going to click this location pin drop. You would click search, and it's going to zoom in on the area of where that individual lives. And this is one of the data points that's required for EV that Nick and Jason have shared. So when you do a search, once you type this in and do a search, there's going to be two options: use this location and address, or use this location, depending on if we need to move that pin drop. You'll notice I'm not typing anything in right now. It's because I saved some time for us today. But after you enter the address and you do the geolocation, the last component that we do recommend that you add is the phone number, the primary phone number of that individual, if they have one. And the reason being is the preferred method for EV is the mobile app, but occasionally we have individuals that we support where there's no cell service or Wi-Fi. And one option you guys do have is what's called IVR, or interactive voice response. And you would want to have this number listed here. If the individual has more than one phone number, you can certainly list those as well. And we'll talk about that in the future in more detail. So after I've entered in that basic kind of meat and potatoes for that demographics, I'm going to scroll down here. I'm going to click save. In therapy, you want to make sure you're clicking save, submit, approve, some sort of purposeful action. Even on the mobile app, when Nick was in the system, he was showing you, he clicked that check mark, that means submit. Once I click save, there's going to be a little successful message at the top of my screen, and there's going to be an option to go back to the form. When you're clicking save, what we're initially doing is you're going to change the status from new to pending admission. Now, I wanted to show you something else, so that's why I didn't actually enter this information. I'm going to click back or cancel either way. And for you guys, after you click save, you're just going to click back to the form. But I wanted to show you guys something else. So we start out with individual intake. We clicked new. We entered in the basic information. I want to show you guys where that individual is now housed. So after we've done initial intake, you can go to your list, and this is going to list out all statuses. So you can see in my demo account, I've got a bunch of individuals that are admitted, but I could also change the status up here to pending admission, or whatever statuses that are listed here. I have a individual in here named Ashley Hayes. She's my demo individual today, but I want to show you something else really quickly. Is you also have this filter. This filter is on the top left. I can start typing. It's going to pull up names that are similar with those couple letters. So I had clicked save earlier to save us a little bit of time with data entry, and you can see that the status says pending admission. So we entered in the basic information. You can see that I entered in the same fields that I requested that you guys will fill in as well, including the address and the geolocation. But if your individual's pending admission or admitted and you notice something is missing, you do have the ability to come down here to click edit. It's going to open up all those fields again for you. So very quickly, I'm going to open this up just to show you guys what that's going to look like. So all the fields are open. And if by some chance I hadn't done that geolocation, I could click that location pin drop and do that now. Or if I missed the phone number, this would be a good opportunity to do that. I did want to quickly show you this location pin drop. As I mentioned earlier, when you click search, it's going to give you these two options. If that's the correct location, you would click use this location. If you have to move the pin drop, you can move the pin drop, and then you're going to select use this location address. And we'll talk to you more about that during our training. If you made any updates or changes, you want to make sure you click that update. And as I mentioned, I wanted to show you this too. When I said earlier, you can just go back to the form. I'm going to go back to the form. And this individual is still pending admission. So Ashley, we need to get her admitted, and admission in Therap really makes them live and active in your Therap system. So I'm going to scroll down to the bottom of this page, and you're going to now see that I have this admit button. So I'm going to click admit. And the admission date again is when, what is that historical date, or when do they walk through the door, your hospital, your agency for any services. So for my demo, I'm going to use 10-1. I'm going to click done. And I'm going to go right back to my form one more time, just to show you guys, you can see that status has changed to admitted. Now there's one last key component to get that individual successfully admitted into your system, and that is program enrollments. If you scroll down to the bottom here, you're going to see this program enrollment. It was also on that prior page. There was a big list of links. There's a lot of information that you can enter into the IDF. Again, we are only primarily focusing on EVV components. Now, program enrollments, we're going to assist you in setting up your programs into the therapy account, but in program enrollments, really what you're doing is enrolling that individual in their specific services. So on this page, you see some basic information regarding that individual, including their status, which should be admitted. Down here under enrollable programs are the programs that you've set up in your system which you can then enroll that individual into. And they can be enrolled in more than one. So if your individual is being supported in multiple services, that's fine. So for today's example, I'm going to click enroll. I'm going to enter my date, and then the program enrollment date could be the same as the admission date, especially for home health. But if it's not, you can change that. And this means what date is this individual starting the service. A lot of times with home health, it is the same. Now you can see that it's dropped that information down to the enrolled program section, and I can see that enrollment date. And if I need to edit, I can. If I need to edit that date, or if I need to discharge her, I can. And just note again, you can change the status. You can discharge or enroll as needed. You do want to make sure you click save to save that enrollment. And that is the process for adding a new individual. So that basic information is required. Again, the name, last name, date of birth, gender, Medicaid number, address, and geolocation, and make sure you do the admission and that program enrollments, and you guys will be successful in the starting process of getting your individuals into TheraP. I'm going to pass it over to Nick. Now he's going to talk to you guys more about users and access.
Excellent. Thank you, Shauna. So I'm just going to, and again, we're working in the same account here. All right. I just want to talk a little bit about users and access. So I do want to show you all just a couple of things. And again, we'll cover all of this information when we do our initial meeting, but I think it's helpful for you all to be able to think about this ahead of time before you get to that point. All right. So you're not kind of trying to make those decisions last minute. Creating users or your staff in the account, you'll need to do that for everyone who's going to be providing services. And you'll probably also need to have administrative staff in there as well. If you're going to be billing with us, you may want to have your billing team get put in there. Again, various roles require various, again, certain roles require certain roles. Certain jobs require certain roles. How about that? Anyway, what you can do here is there are going to be super roles that have been created for you in the account. A super role is something that you can set up, and the best way that I've learned to describe it is just kind of like a very broad description of things. If I click manage here, I can see that I have like an admin level super role and a DSP, or someone who's doing that direct support work. If I needed to create a new one, I could create a new one specifically for someone who may be billing, okay? But without getting too far into all of this, you're able to essentially customize what you want this person to be able to do. So for a DSP in this scope of EVV, you might want them to be able to view that individual demographic information, take a look at their individual homepage, check their medical information if it's listed in there, and then take a look at their schedule, all right? You may not want them necessarily to be able to edit their own materials or schedules. That might be something that you would have maybe a manager do, or a scheduler, or an administrator, something to that nature, all right? If we take a look at this admin and select edit, again, there's multiple things that are here. So maybe an admin is going to be responsible for putting in those service authorizations. Maybe they're going to also be able to be doing billing from here if that's something you're interested in. Again, maybe that's where you're going to give them that ability to edit someone's schedule. Again, you're able to create multiple super roles. You're able to modify super roles. And the nice part is if you have anyone who has this like DSP level, or any of these levels, and you make a change, instead of going in and making that change for every user in your system, when you update this super role, it goes to everyone who has that existing role, which is really nice. The other thing that I meant to mention, or that I wanted to mention as well, is caseload. And again, caseload is kind of exactly how it sounds. There are going to be a multitude of caseloads that are in TheraP, all right? So I'm going to go ahead and just show you a couple of things with these caseloads that we have. So there are a bunch that are going to be generated by TheraP. There are two here up at the top. There's this AAIC, which is all admitted individual caseload. So again, that's going to show just those active or admitted individuals in the system. So like Shawnette was showing you earlier, when she was creating that individual, it was in a pending admission. All right. Since the individual is not admitted, you wouldn't be able to see that. So again, if you are discharging people from your services and you don't want to see people who you're not providing services for, that's what this AAIC caseload is. The second one that we have is this AIC, which is everyone in the account. And again, there are some people who are going to need that. So if you're going to need to modify things for people who are in pending admission, you would need that. If you need to pull records from someone who's no longer there, again, you'll want to have that AIC caseload. We also have privileges that kind of supersede your caseload, and I'll explain those. But again, those are some of the ones that are created automatically. And then as you start creating programs, which again, we'll assist you with on your initial call, you'll be able to enroll those individuals in there. So for instance, Shawnette was enrolling Ashley into, I think it was the Hopkinsville. So if I were to open that up, I'd be able to see, that particular individual in there. So again, if there's a location and someone maybe works between everyone at that location, maybe a program-based superload for that location is right for them. Maybe if it's a manager who runs a particular location or a site or a program, you want to give them that level of access so they just have everyone. And then when you enroll them in there, their caseloads automatically change, and you actually don't have to go in and update that, right? When you enroll an individual into one of these programs, it will update for everyone who has that caseload assigned to them. What I do want to show you, and we'll pick on Ashley here, is you are actually able to create individual ones. Actually, I'm going to do Tyler. Tyler Evans is my guy. So if I wanted to, I could make an individual caseload for every person that's in this account, right? It allows you to get really granular with that. So again, if I have someone who's going to be working with Tyler and with Ashley, and those are the two people that they have, we'll be able to create just a caseload for them. And then I can assign just those 3 people to them, or, a handful of people. So once I add, and again, I should explain a little bit better. There's this list of assignable individuals that I can put in here. And I was just using that filter to find it by the first name. I'm going to move Tyler down to this assigned individual, so he's the only one on this caseload, and I can save it. So now in this caseload list, I can see I have all of those, and then I have that specific individual one as well. So that's just a kind of an overview of what we're going to be doing when we start creating a user, because we want to make sure that you have an understanding of how those roles work, how those caseloads work. To create a new staff in your account, again, not everyone is going to have this ability. As administrators, you can create super admins. I realize that there are probably quite a few people, or quite a few people who have very large agencies and maybe have a lot of staff that they need to put in. Maybe you want to delegate that and create a couple of other people who can create users. Again, it's kind of all up to you to decide who's able to do what in this system. So to create a user, again, we're just going to be on this admin tab here, and under this general section, we'll go to user and new. You'll need to fill out anything that has this little red asterisk next to it, okay? So again, I'm going to go ahead and put in an individual here. So I'm just going to do Matthew Hill. You are going to be required to put in user initials, and they are going to have to be unique. After you've put in a couple of people, it can be kind of difficult to remember the list. So what I usually do is I'll put in initials, hit this little search, and it's going to let me know if it's available. And then if it's not available, you can select alternate initials from there. As Jason had mentioned before, you may want to have, a desired login name, or maybe you want to come up with a format. The one that I tend to prefer is just first initial last name. And as far as password, you can make this as strong or as easy as you would like it to be. What's going to happen is when your staff initially sign into TheraP, they are going to be prompted to create a new password. All right. So again, I'm going to go with kind of this weak one, and I'm just going to hit yes to ignore password policy. You'll be able to select the time zone here. So Kentucky is split. I'm in South Dakota. My state is split too, right? Between Eastern and Central. So you'll be able to select whatever time zone the account has been created in. So again, this is Central. You'll just want to confirm that that's correct. And then for the title, you'll be able to select from a drop down. So I have a couple of things here. If I wanted to create a new title, I can hit this little plus sign, and then I'll be able to put in whatever title I would like. Once I've done that, it's going to show up in this drop down permanently. So I'm going to go ahead and select this direct support professional. And again, that's pretty much all of those asterisk or highlighted things that we're going to have to put in. So I'm going to save it real fast. All right. And then this is the personal details section. You're not required to put or to fill really all of this out. Okay. And Irene, sorry, I see your question there. So will the user be able to change the password themselves after you set them up? Absolutely. So you're going to give them their initial password. Once they log in, it's going to say, hey, we got to change your password. And they will then create a password that is unique to them that only they know. All right. In this personal details section, the only thing that you will need to fill out is going to be that social security number. Again, that's going to be so that we can create that unique ID. So all right, so I'll go ahead and put that in there. But other than that, you can just kind of go all the way down and hit save. And it's going to let you know it's successfully updated. So right now, if we were to go in and sign in with Matthew Hill, he wouldn't be able to do anything. All right, we have created him as a user, but we still need to assign him privileges. We need to tell Therap what we want him to be able to do. And if we don't do that, we don't let them do anything. Okay. So you can select this go to user privilege from here. It's actually a really nice shortcut that I like using. If you skip past it, that's fine. You're able to do it from the dashboard. So I'm going to show you from the dashboard as well. But there is this user privilege section, and you can just hit manage. Again, you'll want to look for your username, and you can do that either in the list or, by typing a first name, last name, login name. This acts as a filter and will kind of remove all those. So I'm just going to pick on Matthew here. And when I'm in here, it's going to ask me, or we're going to have to put in what we want for a super role for him. So he's a DSP. I'm going to select the super role, and I'm just going to give him that DSP super role. When it's asking for caseload, again, this is where you can get creative and you can kind of think about what is going to make the most amount of sense for your agency. So if he is always working at 4th Street and he kind of bounces between a couple of people, maybe I just give him that 4th Street program. If he's only working with Tyler Evans, maybe I just want to give him Tyler Evans. So I can add additional caseloads to this. So as I click add, I have the ability to do more. All right. So again, if you're making individual caseloads, you can make a caseload based off of every individual you have in your system, and you can very specifically assign them to all of your staff if you so choose. So I'm going to kind of lock him down a little bit on what he can do. He's going to have those basic DSP roles, and he's only going to be able to access Tyler Evans. Down here is these agency-wide and administrative roles. And I had mentioned earlier, these can supersede this caseload, all right? So if I give someone the ability to, this IDF admin allows them to put individuals in and to modify data on individuals. By giving someone this, I'll be able to, on that admin tab, add new individuals. I'll be able to see individuals in there because I'm going to be able to edit their information. So these administrative roles have to be assigned per person, all right? There isn't a blanket way to do that. And like I said, we would just want you to be very particular about who's getting what roles, essentially. There are... For DSPs, there aren't very many administrative roles that I would necessarily assign to them. But again, maybe if you want to have like a manager and you want to start delegating things, maybe you want them to be able to create users. Maybe you want them to be able to assign privileges like what I'm doing here. And maybe you want them to be able to reset their staff's password. You can mark those things for them without kind of giving them everything. So for this DSP though, I'm just going to leave most of this blank. We're going to go down and hit save. And like I said, that's going to let you know that those privileges have been successfully saved and updated. And now I am going to go ahead and hand it back to Shawnette. All right. And she's going to talk a little bit about service codes and how to go over your scheduling provider management.
Thank you, Nick. So as you guys can see so far, the system's really designated and designed to kind of control access in the system, which we appreciate here at Therap and for you guys. The next thing I'm going to talk about, and again, I'm going to still be on my admin tab. In fact, your first call with us, you're primarily going to be on the admin tab. That's where we do a lot of the initial setup components. And you will still have to come back to your admin tab as you get new individuals or new users. But the next thing I want to talk to you guys about is sort of your scheduling setup components. So we've talked about the care section where the individuals are housed. We've talked about the general section where the users are housed. I'm going to actually scroll down to the scheduling section. But before I do, I did want to mention we will be doing some setup for your billing too. Most of this has been done for you, like your description code list. Your description code list is really your service codes. And your service codes are important because that's what staff will be checking in and checking out for. And it's also going to be what's housed on each individual service auth. So I did want to show you guys this list, and these have already been imported for you guys, but I think it's helpful to kind of see what this is going to look like. And so you guys can know where this list is coming from. I'm going to reference it again, so I want to make sure you guys can see. One thing that I will recommend when you guys are doing your initial setup is just pay attention to these codes, because you will see specific things like physical therapy. You can see it's the same service code, but they're all tied to a different payer. So we've got Aetna, Better Health of Kentucky, Blue Shield, and Medicaid. So when you're assigning these to your staff, or you're assigning them on the service auth, which we'll get into the nitty gritty with service auths at another point in time, you just want to make sure that you're selecting the appropriate one, either for staff or the service auth. So anyways, if you're ever curious where this description code list is housed, it's in the billing section on your admin side. And if for some reason there wasn't a service code listed, which they should all be there, you could create a new one or export these to Excel if you needed to. So I'm going to head back to my dashboard, and now I'm going to jump down to the scheduling component. And we're going to talk about provider manage. This piece in particular is probably something you won't have to change unless you guys add additional services later. So I'm going to click manage, and we're going to talk about these specific components. On this page in particular, you'll see your agency name, your provider code, service week start date. For some of you, it might not be Monday, whatever that date is here. If that doesn't reflect your agency start date of the week, let us know, because we can change that on your admin side with you. Pay week start date. Again, you can use the drop down to change this and kind of reflect that. So this example is Monday through Sunday. It's really setting up how your calendar is going to look. The next piece that I want to talk to you about is you heard Nick say that one of his favorite tools is using the self check-in option versus pre-scheduling. If you're going to allow your staff to use the self check-inable option, you want to make sure that you select your services. So we will walk through this process with you guys. In my demo account, you can see most services are checked. But let's say we're adding a new service or removing a service. You can either check it or uncheck it, and add these to your list. So you get to determine as an agency which services do we want to allow our staff to use that self-checkable option for. And this is for the entire agency section. So as you're adding new services, especially home health, I've worked with some providers where they're adding additional services. Just make sure that you're updating this accordingly to make sure it's included. Default slot duration, you can change this, but it's going to be defaulted to 1 hour. And that's just how the calendar grid is going to look and the scheduling component. And usually an hour looks just perfect, but the we'll let you guys make that decision. Finally, we're going to talk about daily work hour limits and weekly work hour limits. You'll notice when we log in with you guys, there's nothing listed there. And this is not a required component, but some agencies are trying to track their staff's time. So they might say daily work hour limit is 8 and weekly work hour limit is 40. And therapy is not going to stop your staff from working under or over that. Really, it's just a nice tool to use for reporting so you can generate information to determine which staff members may be working overtime and which ones are working under. But again, the therapist is not going to stop them from working under or over, and they're not a required component to use. Disable verification validation. One option you guys do have with the scheduling module on the mobile app is the verification tool. There's a verify where the individual consumer, patient, client can actually sign that those services were rendered or do a voice verification. This box right here saying disable verification validation, if you don't check this box, your staff have 15 minutes if you guys are going to use that component to use that verify, meaning after 15 minutes, it's not going to allow them to verify. So if you check this box, that gives them more time, it gives them more than that 15-minute limit. So that's a decision you guys can make. Enable verification for scheduler edited slot. What this is referring to is occasionally you're going to have a clinician or a nurse or occupational therapist. Someone forgets to check out. The scheduling admin goes in, edits that visit to update their time. And checking this box is going to allow that staff member, the clinician, to go in and then get the verification if need be. So this is basically after the fact. And again, that's up to you guys. If your agency or the state of Kentucky says we don't have to have any type of verification whatsoever, we don't have to have them sign or do the voice, you can check this box and that'll disable that altogether. Kentucky is a state where EVV services can occur at the same time. So you might have multiple services and you want to check that box. Kentucky is also allowing web check-in. And so if this box is checked, you're going to want to make sure that you enable geolocation. That's one of the 6 data points that's required, location of where that check-in is occurring. And then we enable it. And then also I recommend that you require it. So it's definitely going to track that information. This next component, we also recommend that you check this. Google Maps occasionally has incomplete addresses. A good example is when there's fires in California, a bunch of areas were, demolished and there wasn't complete addresses. Checking this box is going to allow your staff member to check in and check out regardless. And this can occur too for rural areas or newer communities that they're building. You don't have to worry about these pieces, but I will talk to you about this just briefly. This number is probably not the same as your system, but this is tied to that interactive voice response component that we were talking about as a viable option. Of course, here at Therapy, we think the mobile app is the first and best choice because you're capturing all those 6 data points and it's on the go. And most of us have smartphones. Depending on what changes you've made on this page, you want to make sure you click save. And that, my friends, is how you do the schedule EVV provider preference. I'm going to pass it over to Nick, and he's going to talk to you about staff and individual manage. Before we do that, just as a brief reminder, we're not going to cover service authorizations together today, but some of that information, you're going to create your billing providers, where your NPI and Medicaid number. We've been talking about asking you guys to gather that information for us. We will be doing that on that initial call as well. But for now, I'm going to pass over to Nick, and he's going to talk to you about those other 2 components.
Thank you, Shauna. So get back to here. All right. And one thing to point out here is all this is going to take place on that admin tab. There is a privilege that's associated with it. It's the schedule admin role that gives you access down here to what Shawnette was just showing you at that provider manage, but it's also something that you may want to have set up for anyone who's going to be putting new individuals in your system or for staff. All right. The individuals, we'll start with that because it's actually incredibly easy. When we go down and you've gotten new individuals put into your account, really all you need to do is just say if you want them to be set up for EVV services. So I just need to hit that little checkbox next to Ashley and I can save it. So that's kind of all you need to do on the individuals piece. Makes it pretty easy. Again, your staff aren't going to be able to check in and check out for Ashley until there is a service authorization that's created for her. But this is one step that you'll need to take whenever you're entering new individuals that need EVV service. The second piece is really the staff manage and the setup. So if I go to the staff manage, and I'm going to go ahead and look for Matthew here. There are a couple of options that we have, all right? First of all, what you'll want to do, and this gives you kind of like another level of control of how you want your staff to be able to do that check-in, check-out process, okay? First of all, in order to be able to have them do any sort of EVV, you'll need to mark them as being schedulable, all right? So we'll make sure that we get that marked for Matthew here. And then there are a couple of additional options that we have, all right? There is an option for self-scheduling. So it's kind of a niche thing, but you know, if you have a nurse and you want to make sure that they can schedule their own people and have that available to them, you can give someone the ability to create schedules only for themselves, all right? Once they arrive at that location, they're still going to have to do that check-in and check-out process because we need to, again, capture that location. All right. There's also this self-check-in option. All right. So again, Shawnette showed you that list of services that you can select for self-check-in, but you as an administrator are actually going to be able to determine what staff you want to be able to do self-check-in for. So maybe you want that for all of your nurses, but if you have someone who's doing like a personal assistance, maybe you want them to be scheduled. You're able to control that here. Another thing that you'll be able to do is determine what service description code your staff are going to be able to check in and check out for. So again, a good way to think about this would be like for a nurse, right? You wouldn't want someone who is not a nurse to be able to check in for nursing services. So again, if this was a nurse, we would be able to go through and just select really any sort of service that they would maybe be able to provide here. All right. You can remove those as appropriate. Again, there's a combination of things that need to happen for them to be able to check in and check out for this. First of all, for Matthew, he would need to have someone on his caseload that has a service authorization for these services, okay? Again, even if he has this service description code, he won't be able to check in for an individual that doesn't have a service authorization, okay? So again, you can do that daily hour weekly work hour limit. I'm going to go ahead and just save this, and that's going to have to be done per user in your account. So you can really customize that to what you want. And that being said, I'm going to actually wrap it up real quickly, and it's going to go right back to Jason. All right.
All right. Thank you, Nick. And thank you, Shawnette. A ton of great information. And I'm sure all of you out there remember every single bit of it right now. But in the off chance that you don't remember everything that was covered, please have no fear. We do have a lot of resources available for you guys. Obviously, we do not expect you guys to remember everything there. That was a ton of good information, and you're going to be hit with that information multiple times, certainly within the town halls, in the actual one-on-ones that you're doing with our support specialists. So it is going to be repetitive. You're going to hear all of that a lot, but you also have the ability to access that information at any time. So in the last couple of minutes, I did want to, again, draw your attention to some of the additional resources that you have available to you. Obviously, you're going to have your one-on-one specialists that you can refer to in the ongoing instructional webinars, but we have a lot of other training materials, as well as a dedicated EVV site for you guys to be able to see information. So if you see down here on the PowerPoint, you can click on that and it will go to a site within therapservices.net dedicated to Kentucky EVV. And within this, you can see a lot of different resources, from being able to register for the town halls to the recorded meetings for those of you that weren't able to make the first couple, those kinds of things. But we also have training courses around a lot of the material that you just saw Nick and Shawnette refer to. If I go in, I click on that information, it's going to take me step by step through all of those roles and setup that those guys just covered. You have that available to you at any time. let me go back. Similarly, on the same page, we have a lot of other resources that can take you directly to user guides for many of the actions that you just saw Shawnette and Nick cover. So for example, we talked about creating a new user. I can click on that. It will take me step by step with instructions on how to go in and do that. If you want to go in and do, let me go in and see, self check-in. We talked about that a little bit as well. And I know there were some questions about it. I can click on that. We can go in and get step-by-step instructions for how within the mobile application you can select EVV and go down here to click on self check-in. So all of these resources are available to you at any time through the site. And as well, the recording of the information that Nick and Shawnette just went over is going to be made available within the next couple of days as well. We're going to get that posted on that same resource site. So have no fear if you didn't remember everything that was covered. But again, we appreciate Nick and Shawnette taking the time to go through all of that information with us. So with the last couple of minutes that we have left here, I want to review some of the frequently asked questions that have popped up over the course of the town halls, and in particular, a couple that came in last week that we wanted to address publicly here, just to make sure there wasn't any confusion about this. And so we had a couple of questions related to the use of third-party vendors and the therapy agreements. And the first question here was, if we use our electronic health record, or EHR, the existing one that you have for EVV, are they considered a third-party vendor? So I go back to some of the comments I made earlier in the presentation this afternoon. And I really want to kind of distinguish between an EHR and an EVV vendor, a third-party vendor, and all that terminology. Those can all potentially refer to the same thing, but they don't have to. For the context of what we're working on, what a third-party vendor is, this is a vendor that is selected, paid for, and managed by the agency, as opposed to the state-selected vendor, which is Therap's EVV platform. So if you're utilizing any EVV platform that is not Therap, in this context, that is a third-party vendor. So if you're selecting those, then they need to be able to collect EVV data through their application and send it to the EVV aggregator. That's why we refer to them as a third party in those circumstances. Hopefully that's clear, but certainly if not, you're feel free to ask additional questions and we'll try to clarify further. Do please keep in mind this piece right here, that your selected vendor must meet the federal definition of an EVV vendor and be able to share information with the aggregator. And that's one of the things that we're going to share with you all, if that's the route you choose to take. We're going to share additional information with you that can be shared with your vendor to make sure that they have the capability to meet those requirements. We've also had the question pop up, what if my third-party vendor can't meet the 1/1/24 deadline? We have an EVV vendor that we want to use, but we're not sure if they're going to be able to get that information over. Well, we have been requested to direct you guys to the Medicaid public comment email address that you see on your screen. If that's the circumstance that you're facing, we ask that you communicate to Kentucky directly there, and they will provide you with further information. So please feel free to do that. And again, we're going to be sharing these questions out so that you can refer to them directly as well. A couple of other questions that came in. Do we have to use the scheduling component of Therap's EVV platform? This is a great question, and something that was actually covered in the course of Shawnette and Nick's presentation, but we want to make sure that folks really understand what we're referring to there. We often refer to scheduling an EVV almost as if it's one thing, because within our application, it's a single platform through which you're able to schedule shifts, and then staff are able to check in or check out. That being said, the presence of a pre-scheduled slot is not absolutely necessary. As you saw Nick do and Shawnette refer to, we do have the ability to do self-check-in within the system. And again, he kind of went through the steps associated with doing that. I have included right here on the FAQ links directly over. You saw me bring these up just a few moments ago. To the instructions on exactly how that is done. So we certainly encourage you to check that out. If you have any questions about how that self-check-in process works, please let us know. But we've included that for both Android and iOS devices. But you are not required to have a pre-scheduled slot, and therefore not required to use our pre-scheduling component of the Therap platform. We also had a question here. Let's see, what was this one? Oh, okay. This one was a little more related to you guys trying to figure out what it is that you want to do between the use of Therap's EVV platform or a third-party vendor. And what if you submitted that initial job form and you indicated one choice, and now you're realizing maybe that's not the choice that's best for my agency and what we need to do, and you need to change that. Don't worry. Just the only thing that we ask is that as soon as you recognize that, please reach out to us at kysupport@therapservices.net. We've already had a couple of folks with whom we've had some one-on-one conversations. We've actually had several where we're trying to figure out what makes the most sense. We're more than happy to talk with you about your decision, or if you need to change the decision that you've already made, we can certainly help you do that. But the sooner that you make us aware of that, the better, and the easier it's going to be for all involved to make sure we get you into the proper funnel as far as the onboarding process goes. So please reach out to us there. And again, just a reminder, all of the questions that you've seen shared in past weeks and that have been asked, we've tried to aggregate that information and pull it into a single resource that is also linked right there on that Kentucky EVV site. If you scroll down, you'll see that we have those questions in here. We've tried to categorize them as best we can. So if you have questions specific to the EVV platform, to the billing platform, to third-party related questions, all of those, we try to consolidate those here for you. So please get in there and check out those resources. And lastly, I want to give you guys kind of a roadmap of what to expect over the course of the next several town halls. You know, today we focus largely on that onboarding call. How do we do some of the basics of getting our account set up, creating individuals, creating our staff members, configuring things for EVV so that we're ready for staff to be able to do the check-in and the check-out. Going forward, what our plan was, and if you were with us last week, we've adjusted this just a little bit because we've kind of had a shift in priorities. We know we've got a lot of folks that may be out there using third parties, so we want to make sure we talk about that. So we're going to talk more about that third-party vendor onboarding process next week, you know, the completion of the necessary agreements and the attestation and kind of what are the steps that you need to be able to take along with your vendor to get certified. So we're going to talk about that next week. After that, the following week on November 8th, we're really going to get into the nitty-gritty of using Therap's EVV platform. How do I create a scheduled slot? How does my staff check in, check out? How do I, as an administrator, oversee these slots, make edits, submit exception codes? Really, beyond the setup of the system, the using of the system is what we're going to focus on this call. And then after that, we are going to dedicate one of our calls to talking about Therap's billing platform. As we've said before, this is very much an optional platform that if you choose to use it for billing and claiming, you absolutely have it available to you, but you are in no way obligated to use it. But if you want to, we want to make sure you have the necessary information to be able to do that. So we're going to be joined on the call by one of our billing specialists to walk through kind of the administrative setup of how do I take this EVV data that we've been capturing and turn it into billable data and be able to submit claims and all of those sorts of things to your Kentucky Medicaid and or the MCOs as you need to do. So that's kind of our plan going forward with the upcoming calls, and we'll continue to update this as we kind of flesh out the content going forward. And that's one of the things that we certainly want to hear from you guys through the questions that you're submitting and feedback and things of that nature. If there are topics that you don't feel we're giving adequate coverage to, please let us know, and we'll try to make sure we're incorporating that into our town halls going forward. As you can see here, here's the schedule that we're facing over the course of the next several weeks. Again, every Wednesday at 1 o'clock. Only ones we may talk about this. I'll have a conversation with Kentucky about it, whether or not we do the day before Thanksgiving or 2 days after Christmas. We'll discuss. But as of now, the plan is to do these every Wednesday at 1 o'clock through the remainder of the year up through the go live date.